Assalamu alaikum. Thank you to everyone for being here tonight. Before we officially start, we'll begin with a recitation from the Quran from Brother Ayaz.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم واضرب لهم مثل الرجلين جعلنا لأحدهما جنتين من أعناب وحففناهما بنخل وجعلنا بينهما زرعا كلتا الجنتين آتت أكلها ولم تظلم منه شيئا وفجرنا خلالهما نهرا وكان له ثمر فقال لصاحبه وهو يحاوره أنا أكثر منك مالا وأعز نفرا ودخل جنته وهو ظالم لنفسه قال ما أظن أن تبيد هذه أبدا وما أظن الساعة قائمة ولئن رددت إلى ربي لأجدن خيرا منها منقلبا قال له صاحبه وهو يحاوره أكفرت بالذي خلقك من تراب ثم من نطفة ثم سواك رجلا لكن هو الله ربي ولا أشرك بربي أحدا صدق الله العظيم.
Jazakallah khair, Brother Ayaz. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum, everyone. My name is Sharif Abdul Wahab. I am the moderator for tonight's event, and I welcome all of you, brothers and sisters, for joining us for our first ever mental health topic called Understanding Our Minds. Today's event is brought to you by the Muslim Committee the Medical Committee here at MCMC, as well as the Health and Wellness Initiative. As some of you know, this is a new initiative here at MCMC meant to raise awareness about things like mental health and physical well-being. Brothers and sisters, today's event is something, it regards a very important subject, and that's on mental health. We all know, especially in light of COVID, individuals, including ourselves and family members and loved ones, who have suffered from mental health related issues. And for that reason, we decided to hold today's event to start a very important and ongoing discussion, inshallah, on this very topic. I'm very pleased to be joined by distinguished panel members. To my right is Dr. and Sheikh Mateen Khan. To his right is Dr. Hassan Maharaj. And to my left, Sister Rafat Fazal. And to her left, Sister Yasmin Abdul Wahab. Each of them will take their turn speaking for approximately 10 to 15 minutes. And just before Salat al-Isha, we will break to allow people to pray. And following which we'll have a short Q&A session to answer any questions you might have. So with that, let me start by introducing our first speaker, Dr. Hassan Maharaj, who's a psychiatrist in a group practice focusing on substance abuse and addiction. He has over 20 years of experience in clinical practice, working previously at Jersey City Medical Center here in New Jersey. He received his medical degree from King Edward Medical University in Pakistan with additional fellowship training in geriatrics and addiction. Slides will be open.
Bismillah ar-Rahman ar-Rahim. A cell phone? Okay. Bismillah ar-Rahman ar-Rahim. Okay. So maybe I'll come here. Okay. This is really interesting technology. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum, brothers and sisters. I will just briefly want to give some points about, I'm a psychiatrist, so I will, of course, limit myself to my own speciality and try to give you some points which I always think that I need to talk to in general. And then I'll go briefly over the psychiatric or mental illnesses, very briefly, their treatment, and that's all basically. And then, of course, we'll move forward. So, mental illness or psychiatry, what is it? I mean, in general, we see that people talk about depression and anxiety, and these are two big topics. There are other things also in it. But, we all get depressed. We can all get anxious here and there, and especially the stressful life that we are going through. It is very common. And we are down, we are upset. But that does not mean that you need treatment. That happens with everybody, and it's normal. Now, the help when it is needed is when somebody has symptoms in which they cannot function. Now, they cannot function at their job, they cannot perform at their place, or some people even cannot take a shower. The depression comes to that level, or anxiety comes to that level, they cannot get out of their house. So that is where the functions of the life, the daily functions or the basic functions are affected. And that's where, it is that the help is needed. The big point is that the help is available. And I think so. We in general do not know that the help is available in the form of therapy and medications, to be true. And it's evidence-based. Now, this mental health is no more myth, magic, or supernatural phenomena. This is now a reality, and we have to face this reality, and we have to be able to fight it out. Now, very briefly, what happens is that in mental health, the neurotransmitters in the body, in the brain, they get dysfunctional. And this is evidence-based. This is based on the research that has been done. And this is just similar to high blood pressure and diabetes, because the brain is part of the body. It's not separate. So psychiatry is not out of the body. It's inside the body. It's from the brain. And actually, it looks like that after 10, 15 years, neurology and psychiatry will merge together. Interestingly, that the symptoms of psychiatry are different. They are a little weird. And so we think that it is not medical science. A lot of people believe that way. So these neurotransmitters, when they become dysfunctional, then the symptoms of depression, anxiety, bipolar, schizophrenia, all these common illnesses tend to appear. And so this happens. Now, there are many a times there are medical illnesses which present as mental illness symptoms. Depression and anxiety can also present in some medical dysfunctions. For example, if the thyroid gland is not functioning well, then the symptoms of depression or opposite of depression can become hyperthyroidism or hypothyroidism. So that is a medical issue, but it presents as mental symptoms, as psychiatric symptoms. Pheochromocytoma, that's kind of a cancer that presents with a lot of symptoms of the mood. Then there are other diseases, pancreatic cancer. It doesn't appear, people present very depressed, but they have pancreatic cancer. And the Parkinson's disease, that's a medical disease, but then the symptoms are from mental illness. What I'm trying to say is that the symptoms can be from the medical illnesses also. So it's also important to understand that it's not that it's only the mental illness. Mental illness merges into medical problems also and can present as disguised medical problems. Now, some people say that having depression, anxiety is being weak, poor self-esteem, or you cannot survive, or you are very, you can't fight, or you are very low. This is not fair. This is not right. And this should not be happening. And that has become a stigma. And we have to fight the stigma out because people suffer. People have committed suicide. This is because that the people, I have seen my patients who say that their own family does not recognize, does not agree to help them, and they are left alone and helpless. And that brings even worse circumstances, and they even they lose their lives. So, and in mental illness, there are only primarily two emergencies. One is suicide, and one is people kill others. And both of them are very serious events. It is kind of killing and loss of life. So it is, again, becomes a very serious thing to consider. So, as I said, that the research has been done. It is evidence-based, and it is the psychotherapy and the medications both, they play a big part, and both are evidence-based, both are research-based, and it's no more myth, magic, or just talk. So I'm not trying to sell any medications. I'm not a pharmaceutical agent or their representative, but as I practice, I see that the medications are helping, just like the medications for high blood pressure, diabetes, on that. Yes, all medications can have side effects, just like the Brufen or Tylenol can have side effects. So are the psychiatric mental illness medications also have side effects. The point is that what I want to say is that there is help available if somebody needs. In the form of medication, in the form of therapy, and that's what we need to say. Some brief statistics from National Institute of Mental Health. Depression is prevalent in American adults, 7.8% of adults, like 19.4 million Americans suffer from depression. Anxiety, 19.1% of Americans statistically suffer from anxiety. Autism, 1 in 54 children suffer from this. And suicide is the second leading cause of death in ages between 10 to 34. So there were a few points that I just wanted to mention about the mental illness and mental issues, or mental ill health. We can say that in that form also. Now, a very brief overview of the psychiatric illnesses or psychiatric problems that we face in our practice, and they are prevalent in the society, and they present like most common, very common. We say depression. The symptoms of depression are very easy to understand. When people don't feel like doing anything, when their mood is down, people have poor energy, they can't sleep, or they sleep too much, they can't eat, or they can eat very much. And so these kind of symptoms. And bottom line is that when the functions of at home, or functions which really are needed in life to sustain life, get affected, then it's a time to really seek help. Otherwise, a little depression, a little anxiety comes and goes, and we all survive and we go through. So depression could be major depression, very serious depression. People get admitted in the hospital. It could be dysthymia, which is light depression, depression with psychotic features. It comes with, hallucinations and some delusions. Then treatments, we have treatment in the form of therapy, and then there are medications. I just wrote some names. 2 more minutes, okay. I got to get fast. It's Lexapro, Zoloft. The main things I have said already. Lexapro, Zoloft, Celexa, Prozac, Paxil, Cymbalta, Effexor. So there are lots of medications, and there are good medications helping. Anxiety is the next thing. We know you feel inadequate, impending doom, and feeling difficulty feeling and all that. Again, there are therapy and treatment. There are medications, Lexapro, Zoloft, benzodiazepines, hydroxyzine. Let's move forward. Insomnia, could not sleep, inability to sleep, chronic insomnia. There are different forms of insomnia, cannot sleep. Again, there are psychotherapy interventions. There are medications, Ambien, Trazodone, melatonin, Seroquel, temazepam, and all. Obsessive compulsive disorder. I have to go fast. There are, again, medications like clomipene, Risperdal, others. Let's move on. Post-traumatic stress disorder, you might have heard with the soldiers in America who come back from the war, flashbacks, nightmares. Again, there is good therapy. There are medications, Prozac, Zoloft. Autism is there. There's therapy, skill development, medications, Abilify, Risperdal, Lexapro, Paxil. Schizophrenia, we know they have hallucinations. They hear voices. Again, these hearing voices because of the neurotransmitter dopamine issue. It's not magic or myth. Those things. And again, there are medications, Haldol, Prolixin, Zyprexa, Seroquel, Geodon. There are personality disorders. It needs a lot of discussion, but there are sort of personality disorders that are there: borderline, narcissistic, antisocial, paranoid. Next slide. Or it's done. Bipolar disorder, mood swings. People have mood swings, anger, irritability, racing thoughts. They end up in jail, hurting people and all that. And again, there are mood stabilizers like lithium, Depakote, Seroquel, Zyprexa, eating disorders, anorexia nervosa, bulimia nervosa. Then there are addiction issues. We know cocaine, heroin, weed, cannabis, marijuana, everything. We don't have much medications, but working on that. Medications that are used in substance abuse or addiction processes are Narcan, naloxone, Campril, Suboxone, Methadone. Dissociative disorders, multiple personality disorders, and last slide probably. So mental illness due to medical disorders, as I said, multiple sclerosis, IBS, Alzheimer's, all these can present as mental illness symptoms. Somatic disorders, and then ADHD, can't focus, disorganized, and poor time management, and we have medications for them. And then there are new things coming up: transcranial magnetic stimulation, vagus nerve stimulation, ketamine therapy. So I just one line message is that if somebody needs help, the help is available and it's evidence-based. Jazakallah for listening to me, and I'll hand over to the next speaker. Thank you.
Jazakallah kul khair. Dr. Hassan, thank you very much. So with that, we provided an overview of some of the psychiatric symptoms that Dr. Hassan mentioned. With our next speaker, turning to our next speaker, I should say, we'll go a little bit deeper into psychotherapy. It's a form of treatment for some of the conditions that Dr. Hassan had mentioned. Before we delve into the topic, allow me to introduce our next speaker, Sister Rifat Fazal. She's a licensed psychiatrist in the state of New York with over 30 years of experience working primarily with young adults on issues such as depression, anxiety, and relationship concerns. She also worked for 21 years at Seaview in New York City with a focus on geriatrics and their caregivers. She holds a master's degree in counseling from St. John's University and additional training in clinical application of psychology at the National Institute of Psychology and from Hunter College. Sister Rifat, please, can you start?
Hello. Okay. Assalamu alaikum. And thank you very much for showing up, because we are trying to introduce the value of psychotherapy. And I would like to correct Brother Sharif that I'm not a psychiatrist. I'm a psychotherapist, because it's a huge difference. We do not, prescribe medications. We work with different evidence-based techniques to improve issues. So we would like, I'm going to just, because of limited time, would like to bring it to your attention, when, at what time and point, you should seek therapy. So, like Brother Sharif mentioned, I have been working with maybe 3 decades in this capacity. And I am grateful that I had the opportunity and privilege to walk with my clients and help them heal towards their pain and acquire their therapeutic goals. So, so what happens, what is stigma? What happens is that life throws challenges at us all the time. Sometimes we grow up with, childhood trauma. We had a family which was not functional and the issues were never addressed. And we grow up, feeling anxious, depressed, very sensitive to stress, or get angry very easily. But we go through life and we appear that everything is fine, but everything is not fine. You could be 100% functional, and fulfilling all your obligations, but you are still, suffering on a daily basis inside. So it is your duty as providing self-care and self-compassion that you recognize that and take care of yourself and seek help, because stigma is a universal factor. Every society, people are not comfortable talking about mental health because it's not tangible. If we are sick, we could say, my back hurts, and the other person who's listening to you may even give you some attention. But when you talk about psychological struggles, it makes people very uncomfortable. So they kind of dismiss it. So you start to dismiss those feelings yourself. And So you have to recognize that, I am at a point where I need help, and you seek help. There's nothing wrong with that. This is part of self-care, self-compassion. And the thing which is really very important to remember is, if you're not going to deal with your pain, you're going to cause pain to somebody who's very close to you. And these behaviors leads to domestic violence. And people, become adults, little children become adults, they go into marriage and all that. And when they are facing their partners, they haven't resolved their own issues. And they get angry easily. They don't know why. And what happens is that maybe their parents never resolved their issues. So they have no control over their anger. And it affects their family life, their children. So before it gets too late, recognize it. It's nothing wrong with that. You don't have to discuss with anybody. Seek out a professional, and a psychotherapy is going to provide you a platform where nobody's going to judge you. You're free to express yourself, and you're, regarded. Everything comes out of your mouth as a value. Everything, because every behavior is goal-oriented. We do not just behave or misbehave because we want it to, especially if, it's a problem. And we cannot survive on our own. We live in a community. We have parents, children, friends. So it is beneficial to us. If we are going to feel good, charity starts from home. And your well-being, your own person, that's where you need to begin. Why am I feeling this way? Why do I get so angry so easily, and so on and so forth? And they have, the research which was done, the last research which was done, or data reported, was in September 2020. And maybe about 20% people seek any kind of mental health. And women are more, they are more eager, or they are quick to receive mental health, as compared to men. Men are more resistant towards mental health. So what the psychotherapy does, it's going to help you, gives you self-knowledge, self-acceptance, and it will build your resilience and teach you coping skills. So you are more functional in your daily life. You become a better person for your community, your family, your friends, your work, more productive, and you feel good. So, and also the main thrust of psychotherapy is you learn how to communicate. Because a very famous psychiatrist, Dr. Bach, who has written several books, and I consider him my mentor, said that psychotherapy is about communication and failure of communication. And what does that mean? I'll give you an example. Do I have time? Okay, so I'm working with this young girl. She's about 30. She's a young mother. She only had her baby maybe 3-4 months ago. And during her sessions, she always talked about how frustrated she is with how her husband is behaving. He's a nice guy, he works hard, but she is having trouble communicating with him. He doesn't seem to understand her needs. And he works 50-60 hours, and whatever time he is left, he tries to help his mother, who has a disabled child. So of course, this man is also in trouble, so to speak, and she is not happy. And she has no problem that he helps her mother, but she wants some level of organization and structure where she also fits in. So I requested her to ask her husband to join the session as well. So let's see, if maybe he's not able to understand where she's coming from. So he did join the session. 2 minutes. Okay. And in that session, he was surprised that his wife feels this way. She was communicating, but that communication was failing. Why? Because he told me that the reason why I may be avoiding what she's saying is because talking to her is like walking around eggshells, and I'm not comfortable. So there you go, months and months of her talking. Maybe she was, was not properly communicating. So of course, in that therapy session, you can learn how to communicate with your partner and improve your communication before it gets too late and you start thinking about other alternatives. So I guess I have to end right here, but I'm going to, before I leave, I would like to leave with you with some resources. And if you want to get therapy, you can, one is Psychology Today. You can go on website, psychologytoday.com, enter your zip code, and all the providers will come up. You read their profile. If they fit your needs, you can reach out to them. Another way is to call your own insurance company and ask them to give you names. And there is also a Muslim.com health site if you only want to work with Muslim therapist. It's mentalhealth.com. And then there is another company, it's called Lyra, Lyra. That is an employee assistance program. And a lot of big companies, about 25 big companies like Google, LinkedIn, Facebook, all of them have contract with them. And your employer does not have to know that you are seeking therapy. You don't have to go through insurance company. If your employer has a contract with Lyra, only Lyra will know that you are seeking therapy. So there is, help out there. And I will leave my email address. If you ever need to ask me anything, I'll be more than glad to help. Thank you very much. Jazakallah khairan.
Jazakallah khairan, Sister Rifat. And a couple of points just off of what she just said. There are indeed several resources available in our community, some private and some through nonprofits. Inshallah, following tonight's event, we'll be updating the MCMC website to include a list of some of these resources. And as well, as Sister Rifat mentioned, many of our panelists will be here for a Q&A. So if you do have questions about any specific resource or any particular questions with regards to some of the topics that are mentioned today, they'll be here to answer that. Our next speaker, Yasmin Abdul Wahab, actually, her topic segues very well and is related to Sister Rifat's. Sister Yasmin is a doctoral student at the Rutgers Graduate School of Professional Psychology. She's a second-year student focusing on child and adolescent anxiety and depression. Sister Yasmin, please.
Thank you for that great introduction, and thank you, Sister Rifat, for that wonderful resources. I took notes myself for those helpful resources. So thank you, everyone, for joining us today. I wanted to talk more specifically about mental health and youth. This topic is also generally mental health in our community is not talked about enough, and that's why we hold this type of workshop. And specifically with mental health and youth, that's talked about even less and researched even less. So I found it a particularly interesting topic to myself that I'm pursuing a doctoral degree and focusing specifically on this population. And I wanted to kind of bring awareness to this here within our own community as well. So what is youth mental health? Generally, mental health is defined even by the CDC as our emotional, psychological, and social well-being. It affects how we think, how we act, and how we feel. It also helps us determine how we handle stress, relate to others, and make choices. And because of this, mental health is not just something that happens later on in life. Mental health struggles are not something that we deal with only when we get older, only when we go out into the real world. It's something that affects people at every age, from childhood and adolescence all the way into adulthood. Now, what are some of the statistics? So among the general US population, 9.4% of children aged 2 to 17, that's approximately 6.1 million kids, have received an ADHD diagnosis. 7.4% of children aged 3 to 17 have a diagnosed behavioral problem. 7.1% of children aged 3 to 17 have diagnosed anxiety, and 3.2% of children ages 3 to 17 have diagnosed depression. And these do not even go, these numbers do not even include the children who went undiagnosed, meaning that they did not seek out therapy, they did not get a diagnosis. Anxiety and depression in youth has only increased over time from 5.4% in 2003 to 8.4% in 2011 and 12, and even more so with COVID. So the number of youth experiencing a major depressive episode, for example, in the past year increased by 99,000 kids from the 2019 data set. Suicide rates have also increased. How about among Muslim American youth specifically? So this data there isn't much data, but from the data that was extrapolated, it has found that there is also significant mental health concerns among Muslim American youth. So in one study that actually was done with the help of ISNA, the convention that we all know and love, we found that ADHD was actually prevalent among 16% of Muslim American youth, mood disorders 15%, anxiety disorders 13%, and the list goes on. And this even includes comorbid disorders, meaning more than one mental health issue can be in a child and a Muslim American youth at one time. And these are vastly underrepresented numbers because there's such little data on Muslim American youth, because few Muslims go to seek mental health treatment when they need it. The numbers don't even come close to the reality. And so it's very important, just like Sister Rifat was saying, that when we notice a difficulty in our children, when we notice that they're more hyperactive than usual, that they're more reserved than usual, that they're not eating, or they're overeating, or they're sleeping too much, or they're sleeping too little, they can't fall asleep. When these issues start to get in the way for them, they're not achieving well in school, they're having difficulty making friends and keeping friends, they're very anxious or very nervous about themselves and about anything that's related to school. They don't even want to go to school, about any sort of issue that seems to be getting in their way. That's when we know that it's a noticeable problem that we can't overlook. It's not just going to be just a phase and they're not going to just move on from it. So there were actually some common misconceptions that I wanted to address that are common not just among the Muslim community, but just generally among people, and even here in the US, where mental health has grown over the years. So one of these myths is that children and teens don't experience mental health problems. What do they have to be concerned about? It's not like they have a job. It's not like they have to put a roof over people's heads. But the reality of the situation is that even young children, very young children, can show early warning signs of mental health concerns. And this is typically due to an interaction of a bunch of different things, including biological, psychological, and social factors. In fact, it was found that about half of all mental health disorders begin before the age of 14, and about 3/4 of mental health disorders begin overall before the age of 24. And children can experience significant worries in a whole different bunch of domains, as I mentioned, including academic performance, achievement, making friends, fitting in, body image, acculturation, meaning not knowing how American to be, or how of our own cultures, South Asian, Arab, how much of that to be as well as for their own health, especially from COVID-19. We've seen that that's been an issue. Comparison to others because of social media, being separated from parents, and the list goes on and on and on. Another common myth is that a child or a teen can control their mental health struggles like anxiety or depression, or even their impulsivity, if they just tried hard enough. It's just that they're not trying, they're not even putting in the effort. But this is a huge myth. The reality of the situation is that because various factors like biological, social factors, and psychological factors interplay together, children and teens don't have the tools or the skills needed to manage these challenges to get effectively on their own. They need the help of a professional, and they need the support of their family as well, all of this together to be able to navigate these difficult situations. And so seeking help from a professional and following the right treatment plan, which typically includes a behavioral therapy, can help them profoundly in managing their difficulties. Now, with regards to some misconceptions that we have here within our Muslim community, some things that we tend to think of is that shyness is the same thing as anxiety. So my child is just a little shy. They're not anxious. It's not really a problem for them, but that's not the case. So shyness does not always equal anxiety. It's not the same thing. When we notice that anxiety, or the child is getting excessively worried or extremely terrified, thinking about the future, about how things will turn out for them, about how others will perceive them, about grades and their school performance, about being away from mom and dad, about their health or the health of loved ones. And it's getting in the way for them where they can't seem to have fun. They can't seem to think about anything else. They can't get good grades. That is when it's a problem. And that's when you would classify it as anxiety and not just shyness. Similarly with depression, a lot of us, because of social media as well, we tend to throw around the word depression a lot, equating it to sadness, but that's not the case. Depression is when it's more enduring. It's when it lasts over a longer period of time. The person can't really lift themselves up. No matter how hard they try, they have no motivation to do anything. And even the things that used to bring them joy no longer bring them joy. Inattentiveness is also something that is vastly misunderstood, where it could be that, a person can't pay attention midway through the conversation. You tell them something and 2 seconds later they forget it. And that's just, you're thinking that they're just not paying attention to you. They're just not listening to you. They're blowing you off, but that's not the situation as well. That can also be a sign that there's something deeper going on. Another myth is that psychological problems are only for people who are crazy. A child or a teen with a mental health issue is damaged for life. But again, this is a huge myth. And the reality of the situation is that the earlier that the problem or the mental health struggle is detected and addressed, the better the outcome is. And actually not addressing it can lead to worsening problems, where it can lead to issues that do damage them later on in life. Another myth is that having a psychological problem means that you're not religious enough, or that if you're depressed or you're anxious, you just have to pray more and that you'll be cured. And this, I'm sure Dr. Mateen will touch on this in his presentation, but these are also myths that we need to have addressed. Psychological issues are deeper than just not being religious enough or not praying enough. While prayer and religious faith and worship are huge components in treatment and can have huge impacts in outcome, they can't be used alone to treat psychological problems, similar to physical illnesses. You can't just pray that your illness will go away. You pray and you go to the doctor. You pray and you take your medication. So we have to think about mental health in a similar way. Finally, to touch on treatments, as I know my time is coming to an end, there are treatments that don't involve necessarily medication-based treatments or a combination of medication-based and non-medication-based treatments, including behavioral therapy, cognitive behavioral therapy, parent training in behavior management, family therapy, play therapy, and talk therapy, as well as group therapy. And each of these can be used to address different problems in the youth, in the child or the adolescent. And I also have some resources here that may be helpful. They are housed in the Rutgers New Brunswick campus, and they do offer low, affordable, but high quality treatments. So these are some resources, and I'd be happy to circulate them also in the MCMC Facebook page and social media. And I can keep them up here if anyone wants to reference them before we end for today, inshallah. And finally, some websites that might be helpful. We do have the Khalil Center, which is a psychological and spiritual community wellness center advancing the professional practice of psychology rooted in Islamic principles. And Nasiha, which is a mental health hotline specifically made for Muslims, but they do take calls from Muslims and non-Muslims 24/7 from around the world. Thank you all, and I will be around for the Q&A session as well if anyone has any additional questions.
Jazakallah khairan, Yasmin. We're going to pause here and take a break just for Salat al-Isha, but we will resume thereafter with Sheikh Mateen, who is both a alim, mashallah, and also an ER physician. So I encourage all of you here today to please join us after Salat al-Isha, so to partake and to listen to Sheikh Mateen's speech. And then, as we mentioned, there will be a chance for Q&A. So please do join us. Jazakallah khairan. Also, for those on YouTube, we've just posted a QR code for those who want to send in any questions electronically. You can do so anonymously. Also, for the brothers and sisters who are here in person, if you don't feel comfortable speaking up, you can do so anonymously using this QR code as well.
stuff that you talk about on the website?
Sorry, what was that?
You're going to put all the resources on the website?
Yes, inshallah. On the MCMC Facebook page.
Are we leaving? No, I'm leaving. I'm coming. I just want to ask you, like, okay, I've been told it's not covering the session with any actions. Yeah, because she's like ready. She would have been for and now she's not doing anything. She's like no hiding herself all the time. Like she's in a depression right now. And they giving a few days, like 4 or 5 months away from the
Yeah, so actually the resources that I have mentioned from the reference the nice thing about them is that they are sliding scale, so they will go based off of your income and they will give you a rate that would be doable for you.
So nothing is free, like we have to pay something, right?
Yes, but the sliding scale is very affordable. I think it goes from $5 to $60 per session.
Oh, okay.
Based on your annual family income, and then you can also check in with them if you need to, because if it becomes too overwhelming, the fee, you can have a discussion if that might be adjusted. No, not at all. So there's 2 slides. Let me know if you just
Wait, Ada? What are you doing here? I saw you. Yeah, but I got a new backpack and everything else. And I got rayon. Wait, your name's Rayon? Yeah, Rayon. You're not Rayon. Yeah, Rayon. You have to come to my house. Yeah, I have to go. Mama, can he come to our house now? Can Hayden come to our house? Hayden, but he can come to our house if you want. My mom didn't know you're here.
Assalamu alaikum once more. If sisters who need to pray, you can go through that door. It'll go take you straight to the sisters Musalla. Brothers who need to go can go. We apologize, it should have been switched, but
yes. So last time I saw you had some issues. I'm glad.
Assalamu alaikum. Can I ask everyone please to return to your seats as we're going to resume our program? Thank you to all of you. Seems almost everyone here who was with us before prayer returned to join us for the second half of our event. Jazakallah khair for doing that. I'd like to introduce our final speaker of the night before turning to the Q&A session. I'm joined to my right by Sheikh and Dr. Mateen Khan. Dr. Khan is an emergency medicine physician at Robert Wood Johnson University Hospital in Hamilton, New Jersey. He's also a alim who graduated from Al Alamiya program in Dar al Aloom Institute in Canada. Dr. Mateen will talk to us today about the role of mental health and how the scholars have treated it in the Islamic tradition and shed light a little bit more about that. Assalamu alaikum, Dr. Mateen.
بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء والمرسلين حبيبنا ونبينا ومولانا محمد وعلى آله وأصحابه أجمعين أما بعد. This is a very interesting topic, and especially when we look at it from the lens of the scholars and from the lens of ilm. There's a lot here that I think most of us are probably unaware of. And I speak to everybody when I say that, to the esteemed speakers who have already spoken, to our guests, to people who may one day or are currently clients and patients of mental health, and to those who may treat them in the future as well. There are two ahadith that came to mind when I was thinking about this topic. The first is the hadith of the Prophet sallallahu alaihi wasallam when he said, "Ala wa inna fil jasad mudghah," that beware, in the body there is a piece of flesh. إِذَا صَلَحَتْ صَلَحَ الْجَسَدْ كُلُّ, that if it's good and well and sound, then all of the body is good, well and sound. وَإِذَا فَسَدَتْ فَسَدَ الْجَسَدْ كُلُّ, but when there's a corruption within it, then the entire body becomes corrupted as well. And he said, أَلَا وَهِيَ الْقَلْبِ sallallahu alayhi wasallam, he said, beware or know that it is the heart. And then along with that, another hadith of the Prophet sallallahu alaihi wasallam when he said, لِكُلِّ دَاءٍ دَوَاءٍ, that every disease has a treatment for it. فَإِذَا أُصِيبَ دَوَاءُ الدَّاءِ بَرَأَ بِإِذْنِ اللَّهِ عَزَّ وَجَلَ, that when you receive, or when one receives the treatment for a condition, then that person becomes well by the permission of Allah subhanahu wa ta'ala. So between these two hadith, we learn something very important. Number one is that the Prophet sallallahu alaihi wasallam, the Quran and the ahadith, we find a lot of mention of the person, not just as a physical entity, but also as a spiritual, as a nafs, as a ruh. We are multifaceted individuals, and any of those facets can have disease as a part of them. So when one of them becomes corrupt, the entire person will become corrupt. And then from the second hadith, we learn that with all of these situations or all of these aspects, as there are illnesses, there are cures for those as well. And those are seeking out those cures, as I'll talk about in a little bit, is something that we should attempt to do. And the reason you'll see is so that we can fulfill our potential, we can fulfill our purpose. So the Prophet ﷺ, as a part of the hadith, he mentioned that a person becomes well bi'idhnillah, by the permission of Allah subhanahu wa ta'ala. This is a very important aspect of our aqeedah, that when we have an illness, then we seek it out based upon the sunnah of the Prophet ﷺ. But our aqeedah, our belief is that that cure comes from Allah subhanahu wa ta'ala. Now, I want to mention that when we look at the Prophet ﷺ, his speech, his actions, his recommendations, then we see that there is mention of disease and cure. There's mention of seeking out treatment. There's mention of different aspects of a human being. So he laid, sallallahu alaihi wasallam, the groundwork for this, for seeking out treatment. And then we saw afterwards that the scholars continued that and they advanced it even further as they attempted to learn more about who we are. So we see different scholars like Imam al-Sirhindi, al-Dahlawi, al-Ghazali, al-Razi, Ibn Sina, Ibn Rushd, rahimahullah, that they took different aspects that we find in the hadith and the Quran, for example, our nafs, our aql, our intelligence, the qalb, the heart, the ruh, our spirit, ihsas, the five senses, the feelings that we have as well in the external as well as the internal senses that we have. And they worked upon that and they tried to study it and understand it better. Not because of some sort of mental fun, but because there was benefit in it. That if we understand the nature of the nafs, then when the nafs becomes corrupted, we can fix it. If we understand the nature of the aql, then when it starts to think in the wrong way, then we can correct that. When we find that there is ruhani illnesses, then we should seek out the cures for that. And all of that is what these ulama and many others worked upon. And so we find in their works lengthy passages discussing the differences, intricate differences of each of these things. Not too long ago, I was giving a Friday night talk here regularly called the Muhammadan path, or the path of Muhammad sallallahu alaihi wasallam, in which we were going through the different aspects of sometimes the nafs and sometimes the ruh, as it would become corrupted. What do we call it? What are the symptoms of it? And how do we treat it? That was written by Imam Birghi, rahimahullah, who is mostly the one I was taking it from. So we see, and this is the first key point I want to address, is number one, is there is a very long history of ilmun nafs, knowledge or the science of the nafs, of the self, which is what we call philosophy. Psychiatry, wrong to talk. We call psychiatry or psychology. Psychology, the word itself, is ilmun nafs. That's what it means. It's a study of the self, of the psyche. So we see from the time of the Prophet moving forward, the scholars worked on this as a field. And what we also see, and this is the second point that I'd like to make tonight. Number one, that we have a long history of this. And number two, our approach to it was one that was very wide. It was whole. It took into account the entire human being. So we saw that they studied behavior, character reformation,
Testing.
akhlaq. They
Can you hear the
talked
echo? Is it echoing?
It is here.
थोड़ा echo हो रहा? अभी सही है. Good.
Yeah.
$100,000, anybody? $100,000? No, bitch.
Okay, there we go. So these scholars, they drew from a wide range of sources, a wide range of knowledge. So they studied akhlaq, character. They studied how to fix human behavior, how to incorporate medicine, philosophy, logic, metaphysics, kalam from the sciences of Islam, kalam, fiqh, aqidah, tibbun nabawi, falsafa. All of these things were brought together into one field. And then they addressed the human being in that way. So we see around the year 900 of the Common Era, under the Abbasid Caliphate, we had established a psychiatric hospital. In the year 900. What is it, 2022 now? So somewhere along the way, the Muslim world stepped away from this. Well, we approached it in a holistic way. We approached the human being in a holistic way. When you went to the physician, then the physician would look at you and diagnose you based upon multiple sources, taking into account all of you. That this symptom that you're showing, this has to do with your nafs. This is your psychology. This other symptom, this has to do with your akhlaq. There's a problem with your qalb. This other symptom that you're showing, this is a problem in your ruh that needs to be addressed. The ruh itself has purpose to it. One of those being that it wants to seek out its Rabb. So when a person doesn't seek out its Rabb, there's something wrong there. That needs to be addressed, that needs to be treated. So the Muslim world had hospital systems already. And in fact, what's really interesting is you can look at it from the perspective that it had maybe clinics and then bigger centers as a hospital. So in local areas in your neighborhood, you would have things like zawiyas, khanqas, makatib, madaris, hakims, who would treat those things that they could treat. And whatever was beyond them, they would send it to the psychiatric hospital, Bimaristan. And they would treat them there in a more concentrated way with more expertise. So we had this. So then what happened? So some of the scholars say, and I lean towards this as well, it makes a lot of sense, that there was a shift that happened in the Muslim world. Let me take a step back. The purpose of a Muslim's existence, وَمَا خَلَقْتُ الْإِنسَ وَالْجِنَّ إِلَّا لِيَعْبُدُونَ, that Allah subhanahu wa ta'ala says that we created mankind so that He could worship. This is our purpose. So every aspect of a human being, when we look at it, is it diseased? Is it working? We're looking at this in the back of our mind. Is the person able to fulfill their purpose? If sometimes there's a physical aspect that prevents you from fulfilling that ibadah. And of course, remember, ibadah, we're not just talking about salawat and sawm. We're talking about much more than that. So is this person able to fulfill that purpose of his? If he's not, if it's a physical problem, let's treat that. If it's a mental or psychiatric problem, let's treat that, so that we can get him to be in a situation, in a state that he can fulfill his purpose. So the purpose of good mental health from an Islamic perspective historically has been that we restore people back to that function. And wherever we find some sort of barrier that prevents them from fulfilling that function, then we fix that. So you'll notice that from a psychological or psychiatric perspective that we deal with today, the primary focus is getting that individual to be more functional in his society, in his community, which is definitely an Islamic aspect as well. But we look at it even bigger than that. Sometimes a person may have the disease of kibr, of pride, and he may function totally fine in an environment. He may work, he may have family, he may do all of these things. But this is a disease that will destroy his akhirah. It needs to be treated. This used to fall into this whole aspect of treating the human being. So dysfunction is whatever will pull you away from your purpose, what will pull you away from Sirat al-Mustaqim, and treating that is to bring it back. So today, when we find ourselves suffering from some psychiatric illness or mental health disorder, problem that is preventing us from fulfilling these purposes, then we all already have a very long history going back to the Prophet ﷺ and in every corner of the Muslim world where we used to take care of this. Keep in mind, there is a juristic principle that whatever helps you fulfill a command in the deen, it takes on a similar ruling. Let me explain that a different way. Whatever helps you fulfill a fard, it itself becomes fard, so that you can fulfill that fard. Meaning if without that you cannot do it, then that will become fard on you to do. Similarly, that which is a sunnah, whatever you need to fulfill that sunnah, it itself becomes a sunnah. So if a person has their salawat to do, and they oversleep now because of depression, or they can't get themselves up to do something because of some other mental health problem, then treating that becomes a fard so that they can fulfill that fard that they are lacking right now. This is a common juristic principle. All of the madhahib agree to it. Now, I'm going to go out on a little bit of a limb here. And I don't mean to disrespect anyone, but rather what I'm trying to do is open our minds, broaden the horizons. That what's happened to the Muslim world is that during the period of colonialization, during the period of Western hegemony, then we've walked away from the sciences that we had, the approach that we had. And we started seeing all of this in a different lens. When I say Western, what I mean by that is a Western heritage. I myself, when I practice medicine, my medicine is based in a Western heritage. You can trace its lineage back to Greece and Rome, not to the Muslim world. Well, you can. It takes a detour and goes there, but eventually comes back to that location. A lot of psychiatry today is the same thing as well. Mental health is the same thing as well. And so what I'm trying to do is open your mind to the aspect that there is benefit in what we have, but there is a wider field that we need to look at. Our ulama, whenever they approached the sciences, they looked at three things. In any science, they looked at three things, whether it was biology or whether it was fiqh. There were three things to look at. Number one was that which is empiric. The five senses. What can you look at? The knowledge that you can gain by hearing, seeing. That's one area of knowledge. The second area was your intellect, your reasoning ability. And so we use that to determine those things which we can't. We use this in science all the time. We use it in psychiatry, mental health, medicine, biology, chemistry, all of that. We use these two sciences currently. But our ulama had a third field of knowledge that they added on, and that was revelation. What did Allah and His Messenger ﷺ tell us about ourselves, or tell us about the universe? And we took that as a third source. But Western heritage is not that, right? Western heritage abandoned revelation a long time ago. And it only looks at a human being from the lens of empiricism and intellect. It has lost a very important aspect. So it secularized the human being and the treatment of the human being. So with that as an introduction, this is really what I wanted to come across. There's a lot more that can be said about this, how to approach it, how to go about setting it up and benefiting from it. But I think this is sufficient for tonight, or at least for now, that we open our minds to the idea that if we find ourselves moving away from mental health, then this is not what we find in our heritage, in our Islamic heritage. This is not how the Ummah has been from the time of the Prophet ﷺ. And then number two, rather than pigeonhole ourselves into the treatment modality and heritage of another culture and heritage, that we instead open it up to the sciences that our deen brings to us, and we've had a very long history with. Am I out of time? Okay, so I have time. Let me say a couple more things then. On that route, and I would say to you guys to look at your own fields in the same way. That when we look at this particular field, we can look at it in two ways. Either you can look at it that this is Western psychiatry, and look at it with a Muslim lens. So you say, okay, right now the treatment for it is this. What does the hadith say about it? So what you're doing there is you're bringing one modality, you're bringing one heritage, one science, one source first, and then you're saying, okay, let me put on my Islamic lens and look at that source. This is one approach, and this is a common approach that gets done. The other approach is that you look at it from a native Islamic approach. Forget about the other heritage, forget about all of that. Let's start with the deen and work up from there. So when we look at it from the perspective of those three sources that I mentioned, then revelation tells us a lot about who we are and how to treat us. And then from the other aspect, there's still the aspect of empiricism and intellect. And so when we look at that, we see evidence-based medicine, evidence-based psychiatry that we can incorporate as a whole into this model and work from there. There's a few barriers that we find among Muslims that prevent them from seeking mental health, and I wanted to address them very quickly. The first one is that we forget that spiritual health is tied in with mental health, or mental health is connected to spiritual health. If you don't have good mental health, you will likely not have good spiritual health. If you're falling into depression, then you will have a very difficult time achieving what you want to in terms of spirituality and connection with Allah subhanahu wa ta'ala. The other aspect is the lack of incorporating Islamic principles, especially spirituality, into how we treat one another. So these are barriers. Because we don't see that in there, sometimes we go running to the Imam and we only want it from the Imam. And as I said, the Imam is a part of it, but he's not all of it. Sometimes we think that mental health as its practice is at odds with Islam. And truthfully, sometimes it is. If the practitioner is recommending for you to do something that is impermissible in the deen, then it's at odds with the deen. So we have an obligation on both sides. We have an obligation on the side of the client, the patient, the individual, all of us, that we be open to it, but we also have an obligation on the side of the practitioner, that they understand what the deen is saying, that we study the deen on the side as well. In my field, what does the deen have to teach me? As a physician, I take care of patients. What can the deen teach me so that I can bring that and better take care of people? It's imperative. That has to happen. And as I mentioned before, that modern psychology is sort of a colonialist endeavor that's rooted in Western heritage and then pushed on the Muslim world, and in doing so pushed out what we had been doing before. That doesn't mean it needs to be thrown out or ignored. That means it needs to be incorporated back into the proper balance that we used to enjoy or we used to have before. There's another one I want to mention, and that is, as Muslims, we're very quick to blame the jinn. We're very quick. Brother has anxiety, it's a jinn. Brother's depressed, it's a jinn. Brother's acting off, it's two jinn. We're very quick to do that. But this is not how we found our scholars approaching it. Can the jinn have an effect? Absolutely. Do the jinn cause people to have issues that may seem psychiatric? Yes, they can. But the approach of the ulama has been two things, and I'll stop with this because this is, I think, maybe something important as a barrier from Muslims to mental health. I myself have taken care of many Muslims in the emergency department. Their families drop them off and say, "Oh, thank God you're a Muslim. Assalamu alaikum. You know, we say it's bipolar, but it's a jinn." And now I don't know if I'm bipolar, jinn, what am I dealing with here? The ulama tell us two things. Number one is that first and foremost, you look at it from the perspective of the human being. Treat the human being first. Look at him as a physical entity. Look at him as a psychiatric entity and a spiritual entity. Find the problems there and treat that. It's very easy to dump the problem on the jinn and say, "I'm perfect, I'm good." It's the jinn's fault. Oftentimes most of the time the fault is with us. That's one thing to keep in mind. So we start treatment with the individual. When we can't do it, then we start thinking about the jinn. Number two is that jinn love filth. They love filth. This is why we find them more often in countries that are third world countries. There's a lot more filth, najasa, lying around. This is why we find them in the hearts that are filled with najasa as well. They gravitate to that. That's what they eat. That's what they love. They like that company. So if you're concerned about a jinn, my teachers would say the very first thing is get rid of that najasa in the heart. Recite Quran, do adhkar, get rid of the najasa around you. You cannot disobey Allah all day long, fill your heart full of najasa, of music and movies and trash, and then expect the jinn to not want to come there. That is their home. You invited them. So khair, it's a very long talk, but inshallah I'll stop with that. Jazakumullahu khair. Assalamu alaikum.
Jazakallah khairan, Sheikh Mateen, and to all of our speakers today on today's panel. This concludes the discussion portion of tonight's event by our panelists. I appreciate that the time is rather late in the evening for some of you and your families, so I did want to give an opportunity to those who do need to excuse themselves to do so. Thank you to everyone for attending today. Such an overwhelming group of people, to say the least, beyond what we had expected, mashallah. Allahu Akbar, and we hope that this is the first conversation in an ongoing discussion on this very important topic. So I want to give a minute for those who need to excuse themselves to please do so. And in about 1 minute, I would like to then pass out pieces of paper to those who are interested in writing down a question anonymously to do so. Anyone who's not shy and wants to speak, there is Dr. Mushtaq in the back who will hold a microphone and give it to the person who would like to speak. For those who are still with us virtually, there's also a couple of links that were sent out, one of which is to the QR code that has access to an anonymous online questionnaire for you to upload your question. So let's just take 1 minute for people who need to excuse themselves, to do so, and then we will begin very shortly. Thank you.
Assalamu alaikum. Sorry for my question first because I just attended this. I thought that it will be in the weekend, but I was wrong. So I want to get so here. My question is: I thank you for this speech. Was very interesting one. Is regarding the Islamic perspective, of course, for mental health, which is something very important. I don't really agree about the way how really about the way how we separate things sometimes when we talk about Western things, because Islam also he contributes on that. So, and that I prefer that a lot of Muslims they don't go to that directions. And my question is about Ruqya. You did mention this aspect, and that maybe is very important right now for Muslim, that at least we can say for Muslims that they don't go for something like they don't go for medication or something like that. How can be beneficial as your perspective as physician and on those aspect? That's my question.
Was that question for Sheikh Mateen?
Yeah, for any, I mean, because I just heard him.
Sure.
Bismillah. The question is about ruqya and using that as a treatment modality. So, of course, the use of ruqya comes in multiple ahadith of the Prophet sallallahu alaihi wasallam, and its use among the by the Prophet sallallahu alaihi wasallam in the early companions is really without a doubt. But when we look at it from the perspective of, so what I was trying to impress upon all of you is that we look at this from a wide lens, and we look at it from all of the different types of modalities and treatment options that we have. And we look at it from the perspective of all of the different sources and causes of diseases and illness that can occur in a human being. And so first, the reason that I make that dichotomy between Western heritage derived and Islamic heritage derived is because Western heritage as it exists today has excluded revelation completely. It's purely empiricism and physicalism. It's basically just one modality at this point. So as Dr. Hassan was saying, that even in the future, likely, we will find even the psychiatric field melding with the field of neurology and brain science as we kind of focus in on just one aspect of a human being, and that is one that is purely physical. Whereas the Islamic heritage has not been that way. It's been very much broad than that. So that being said, what we would like to see in a practitioner is the ability to bring all of this together. Maybe not even one individual. You can have multiple people with different specialties, different knowledge bases, and then bring them together. So then we would assess this person and say, based upon the symptoms that he's showing, for example, that he may have this physical problem, then we will treat that physical problem. He may have this psychiatric and mental health problem, we will treat that. He may have this ruhani problem, we will treat that. We might find that based upon our experience that this certain adhkar helps this condition. So we will prescribe that for him as well. We find that this ruqya has been tried and tested in the past, we will try that as well. At the end of the day, what is medicine other than things that we have tajriba with, right? It's medication that we've tried and we found it to work. Ruqya is like this a lot, most ruqya is like this as well. They are tried and tested and we found them to work. So we would use all of these modalities. There's no reason to be restricted.
As alternative medicine in the West?
Is it what? I'm sorry?
Alternative medicine.
So yeah, again, from the Western perspective, because this is not, the use of ruqya is outside of empiricism. It's outside of empirical treatment. There is no measurement of it. We don't do randomized trials for ruqya because there's no physical basis to it. So from the perspective of Western empirical sciences, there's no reason to even look at it. And most doctors will laugh at that. It's alternative medicine, right? It doesn't fall in the purview of science as we practice it today.
One follow-up question. This one's from online, Sheikh Mateen. What is the boundary that tells us that this is a spiritual problem versus a genuine mental health issue, to the extent there might be one?
And this question is not, it's not a black and white question. As Dr. Hassan was mentioning earlier, there are certain symptoms for anxiety. For example, anxiety can be the cause of hyperthyroidism or pheochromocytoma, whereas there's a medical issue to be treated. That same exact symptomology can be from a psychiatric disease, a true anxiety disorder. That same problem can be from a spiritual disease as well. When a person doesn't have proper tawakkul in Allah subhanahu wa ta'ala, oftentimes it shows up as anxiety. So it's very difficult to say that this is the boundary, this is a cutoff. If he has this, then he has this particular aspect, and so on. So really it requires practice, expertise, sometimes sending people to multiple different specialists to differentiate. And at times, even in medicine, when we cannot differentiate clearly, then we use different modalities. We may use psychotherapy in OCD, and we may use medication as well. Use both of those modalities to treat, and so it will be sort of along the same lines.
I wanted to give the sisters an opportunity as well. Are there any questions on the sisters' side? Yasmin, can you tell me if someone's raising their hand or has a question? No? Okay. If anyone wants to ask a question, I'll give you the mic. If anyone wants to ask a question anonymously, there are also pieces of paper here. Just raise your hand, and Dr. Mushtaq or one of us will pass that to you. Did you have a question? I'll come to you. Please, when asking your question, can you direct it to a particular member? Thank you.
Assalamu alaikum. Sheikh Mateen, thank you for the talk again. So I was wondering, and I know it's not black and white, and there's a lot of room for subjectivity and everything, but in your experience and talking to other shaykh, when somebody has a problem where you see that the direct solution to it is Islam and submitting to Allah, whether they're a Muslim or not Muslim, and they're resistant to that. So they have a disease and the solution is Allah, but what's preventing them from coming to Allah is the disease. So it's kind of like a both-way problem. Like they won't accept Islam or submit to Allah because of the disease, and the disease won't go away because they're not submitting to Allah. So like what's the first step in this type of situation, if there is one?
Thank you.
I was afraid this would happen tonight. I was debating, should I speak as an emergency physician? Because that would be very easy, or if I should bring up all of these topics into it. But I thought, mashallah, all the other speakers would be able to handle the psychiatric realm far better than I would be able to. So this may be something that I could add. Finding people that are resistant to treatment, I think, is something that everyone on the panel can say they have experience with. Whether it be medical, physical, versus spiritual, versus psychiatric and mental, this is across the board. We find people that have resistance, and oftentimes their problem is what makes them resistant. You have someone, for example, with a narcissistic personality disorder, they're very resistant to treatment. This is what we diagnosed the previous president with, and he thought he was perfectly fine. Similarly, we find it in the aspect of deen as well, that people are completely unaware. So I think from the perspective, or at least the example that I've seen from my own shuyukh, that the treatment for that person is the example of the Prophet ﷺ, that we approach them with love and kindness, care and compassion, that you sometimes have to spend time with them to show them that Allah subhanahu wa ta'ala wants them to return. And eventually you break down those defenses. As I kind of mentioned earlier, that one of the aspects of the ruh is that it wants to reach out to its creator, naturally. And there are barriers that we develop, our communities develop, as the Prophet ﷺ has said, that every person is born upon their fitrah. So that fitrah is it wants to go back to that Lord, which they said, Bala shahidna, right? Allah subhanahu wa ta'ala asked and said, of course, you are a Rabb. That ruh remembers, it wants to go back to it, but the barriers are there. And so we take the example of our Prophet sallallahu alaihi wasallam. We spend time, we talk to them, we show them care and compassion, and we break down those, inshallah, they return.
Jazakallah khairan. Before we continue, I just wanted to inform those who came after Salat al-Isha again about our panel members. We're joined today by 4 distinguished panel members. To my far right is Dr. Hassan Maharaj, who's a psychiatrist. To my immediate right is Sheikh Mateen, who's also an emergency medicine physician. On my left, on the sister's side, is Sister Rifat, who's a psychotherapist and not a psychiatrist. And all the way on the far left on the sister's side is Sister Yasmin Abdul Wahab, who's a doctoral student studying clinical psychology with a focus on adolescent-specific anxiety and depression. The next question, I understand, comes for Sister Rifat specifically, so I'll pass the mic over to her.
Yeah, the question is, what is the most common reason people come for therapy? So the most common reason is relationship concerns, mostly with their significant other, husband, wife, fiance, or people they are going out with, or parents with children, children with parents, and so on. So it's always surrounds around relationships. I hope I answered the question.
Assalamu alaikum. I have a question here. The question is, so many young kids are on medication. What is the most common underlying issue, and is there any research on this? So there are medications that are provided to children as a form of treatment. A lot of the medication can be to treat ADHD, especially because it's a behavioral disorder and it does have a lot of biological underpinnings to it.